Hello, everyone, and welcome to Day 2 Wrap-up at the HFA studio by ESC TV. I'm Antonio Canata, and it is a pleasure to be accompanied today by Dr. Fuzia Ahmed and Professor Stefan Sturck, that we're going to wrap up the day. As you know, Monday is not just science, it's science and excitement and a lot of fun at the Congress at the HFA. So without any further ado, let's crack on. Hello, Fuzia. How are you? How was your day?
Yeah, the day was good. I guess what I'm going to do is jump right into the science. So it's a pleasure to be here to unpack not just the scientific highlights, but also the key moments of day 3. The latest session we went to was on Attribute CM, which was a trial of acoramidis, which is a near complete TTR stabilizer, which in a previous trial has been shown to have proven efficacy to reduce all-cause mortality and cardiovascular hospitalizations in people who have ATTR cardiomyopathy. This current trial, this current analysis was a post-hoc exploratory analysis that went beyond that to examine the impact of acoramidis on outpatient worsening heart failure events. So this concept that worsening heart failure that requires oral diuretic intensification is bad for your health, associated with higher risks of hospitalization and death. What they showed in the analysis, in this modified intention to treat analysis, was that 47% of patients in the study had a worsening heart failure event, and that this was a predictor for death and hospitalization. They also showed that treatment with acoramidis was associated with a 41% or an 18% absolute reduction, 41% relative reduction in the risk of outpatient worsening heart failure events. And the number needed to treat was just 6. So treating 6 patients with acoramidis was associated, well, prevented 1 outpatient worsening heart failure event. So not just a TTR stabilizer, but having a stabilizing effect on disease progression and bad events.
Well, sounds interesting because we are also having very low numbers needed to treat, so we can actually prevent a lot of events. And it's not just people that come to the hospital, but actually stopping them before coming to the hospital, which is very important. And what about you, Stefan? What's your highlight of the day?
Yeah, in the same session, the attribute CM was further analyzed with regard to another aspect. And the authors looked into the utility of serum TTR as a potentially new biomarker to study the effect of acoramidis. And after day 22, the patients experienced an increase in STTR. That was their study concept. And after that, it was repeatedly measured up to 12 months. And these iterative measurements were at the core of this analysis. So authors looked at the variability of the STTR measurements and whether they stayed at the ceiling or whether they had some drops. And various conclusions could be drawn from these findings. So low TTR effects were associated with more severe disease. And actually, if the STTR remained high over time, the level was high and the variability was low, these patients had the best outcome. Vice versa to the other components, if the STTR was not as high and the variability was higher, then the outcome was not as good. So the conclusion was that these fairly cheap biomarker could be used in the future to study, to get an impression on disease severity, study response effect, and actually also calculate prognosis. And this is particularly important for amyloidosis centers who see these patients iteratively over time.
Yeah, it is very interesting because we have new drugs, we have biomarkers. It was also the day for cardiomyopathies, the traditional cardiomyopathies. What's your highlight of this?
Yeah, so same session, different disease. We're looking at now hypertrophic cardiomyopathy, and they had an additional readout from the Maple HCM trial. So if you remember with Maple HCM, they showed that aficamten, this next generation cardiac myosin inhibitor, which has got proven efficacy in a previous trial to improve peak VO2 max, improve hemodynamics, and improve symptoms. Now they examined the dose-dependent effects of aficamten monotherapy versus metoprolol monotherapy. And what they showed kind of challenges existing rhetoric, dogma, and guidelines. What they showed was that aficamten improved not just the primary endpoint of peak VO2 max, but also improved the secondary endpoint. So it reduced LVOT gradient, It improved LA volume index and it reduced NT-proBNP. In comparison, metoprolol, a beta blocker that it currently has a class 1 recommended guideline indication in European and American guidelines, did not improve any of those endpoints at any dose. So really, for me, the take-home message from that trial and being in that session was perhaps beta blockers have got a role in as having antiarrhythmic effects in these patients, in this population with HCM, obstructive HCM. But their role to reduce gradient and improve outcomes probably is not as strong. And that 60 years of perhaps lack of evidence is now being challenged by these next generation myosin inhibitors.
And we already see that the guidelines might change at certain point in the future. So it's exciting to witness, to make the history today. But I assume it's not just science, because I've seen at the end of the venue that there were people running around like they were doing a 6 minutes walking test. Have you done it? What was that?
I didn't run. I was very British and I walked. We have one foot on the ground at all times. 6-minute walk test. We had the El Clasico yesterday between Madrid and Barcelona. We also had the multinational 6-minute walk test challenge. Stefan, I suspect you did better than I did. I was in the red.
I did wonderfully.
Poor functional capacity. But readout tomorrow?
Sorry?
Readout of the results tomorrow?
Readout tomorrow, yes. I think we collected 250 runs and walks. And was a very nice platform and test bed to improve this app, which we think will be distributed at a larger to a larger community next year.
Wonderful. So big shout out to the athletes that we have in our community. Unfortunately, is all the time that we have for today, and I wish to thank Fuzia and Stefan for being with us today. And I acknowledge that there's been a big congress, it's been a busy congress, but I'm sure that you're gonna tune in tomorrow for the last wrap-up of the HFA at the HFA studio by ESC TV. Thank you very much.
Sure.